Hello, everybody. This is Pastor Morris here, and I am delighted, excited to come to you this morning just to have a conversation about the coronavirus, COVID-19, with some very, very interesting, inspiring, wonderful individuals that I know, members of Kansas Avenue, and we all together felt that it would be good for us to just have a Sunday conversation on COVID-19, the impact, the effects, and what we can do, how do we respond, and we're just gonna have a dialogue on it and see how we can come out of this. There are several individuals who are home right now who probably need to hear some encouragement, things to do, and stuff like that. And so we want to do that this afternoon. We have on, let me go ahead and introduce the individuals that we have on. Bear in mind, I say it one more time, these are all members of the Kansas Avenue Seventh-day Adventist Church that I am so honored to be the pastor of. And we have Dr. Columbus Batiste. He's on. I want for you to know that I love him dearly, although he's a Cowboys fan. I still,
Mercy.
cherish him dearly. We also have Dr. Anissa Bryant, who is on, and she just did a double. Is it a double shift? She just worked
this morning. Yeah, morning shift. Yes.
Oh my Lord. So we have her on, and we're thankful that she's joining us. We also have Dr. Ian Sandy, who is on. He and I, we partner all the time in terms of how we attack Dr. Batiste on his team. We had a good Super Bowl party at Ian's home and had a good time. We also have Dr. Jeanette Francis, nurse practitioner. She's going to bring some perspectives there for us. And we want to thank her. She's one of our elders at Kansas Avenue, and we want to thank her for her ministry at church and also her service in the healthcare area. And joining me to talk will be Pastor McBride, Edwin McBride, who is our youth pastor at Kansas Avenue, and Pastor Carl Ricketts, one of our elders, but he also serves as chaplain at Loma Linda University Health. Everyone, welcome. Good to have you.
Thank you.
Thank you.
Good to have you. So let the conversation begin, and this is where I want to start. I've heard some things out there about the coronavirus. One of the things that I've heard is you can get the coronavirus if you eat at Chinese restaurants. And if you receive a package from China, or I've heard pets can spread the virus, and some people have gone as far as to saying if you rinse your nose with saline or if you gargle with bleach, these are things that can prevent or protect you from the coronavirus. Come on, docs, and just let's talk about that. What are some of the things that we need to be mindful of, and how do we respond in preparation, and or if we ever unfortunately test positive for the virus?
Well, I would say to those myths that you are alluding to, all of those are false. And gargling with bleach is dangerous, so don't do that. Okay?
Please
don't. This virus is spread by person-to-person contact. This is why we are practicing social distancing, okay? And it's spread by droplets, by sneezing, by touching your face, or touching a surface that has the virus on it and then touching your face. Okay, it is more infective and more deadly than some of the other viruses that we've had before. And that's why we are all so concerned about it.
So one of the things I want to add is that coronavirus isn't new. This is just a new strand. And so around flu season, a lot of times we have people who come in with what we call the common cold, and we really don't test you because your body's immune system is able to pretty much fight it. The reason why this is so scary is that the severity, such a wide spectrum of severity of the virus. And when people get a common cold, you don't think that people are going to necessarily have to be ventilated and hospitalized. So that's what brings the fear to some of this. And like Dr. Sandy said, like diligent hand washing, it is a droplet, making sure that you're washing your hands. It's something they taught us when we were 3, 4, 5 years old, washing your hands appropriately, making sure that when you cover, like your mom used to tell us, cover our hands or cover our mouths when we cough and things, and then, like wash your hands. Those types of things are very important now. And because I think there is fluidity, meaning it's very fluid and the information is coming out like as hour by hour, we do know some things. That's why the social distancing is pretty much what we're trying to have you do, because we know it's person-to-person contact, we know it's droplets, we know it's touching things, but it spreads so fast. So I think there's still some uncertainty that's there, and I think it's very fluid.
They're still working on the research, but I think that they are saying that these things can hang around a lot longer than before, right?
Right.
Droplets are hanging
72 hours, 72 hours on a hard surface, and on a porous surface up to 24 hours.
Exactly. And it's hanging in the air for about 3 hours, right?
Yes.
So it's easier to contact. So yes, we're washing our hands real well with soap and water.
And the latest thing I saw regarding sneezing and coughing, it's a little discouraging. But remember, first they told you cover your mouth with your hand.
Yeah.
And they said, no, don't do that. And then sneeze into your elbow.
Yeah.
Well, I saw a little experiment where they did all these things, and the only thing that prevented the spread for 8 feet, 10 feet, 12 feet was to sneeze into a piece of tissue. That was the only thing. So who's carrying tissue all around at all times? But that's
I am.
you are. we should be encouraging that.
Instead of buying toilet tissue, we need to be buying
We need both.
So that's what all those rules are for.
Hey, I guess they're using it, multi-purpose, multi-use. Mercy.
So we talk about social distancing. Now, that is something that a whole lot of people are finding hard to deal with and to handle. Huggers and handshakers, people who like to touch and stuff like that. Now, talk to us about that a little bit more. Why is it so dangerous for individuals to keep up that practice, although it's good intentioned?
The main problem I'm finding with this virus, I don't know if this is true with other viruses to the same extent, is that there are people walking around who feel fine, who are spreading the virus. They have it and they're spreading it. And you can have it, you could be in the incubation period, which is several days, and you don't feel any symptoms, and you're going to work and you're doing all these things, and you can be spreading the virus to other people. So what social distancing is doing is keeping people apart to try to keep them from spreading it unintentionally. You see, so if I feel fine, and you tell me you feel fine, then I'm going to feel as if I can hug you. You're my friend. I want to hug you. I want to dap up, do all that stuff that we normally do. But if I have this, I'm carrying this virus, and I do that, I may have just given that to you or to someone who's vulnerable. Mm-hmm. So what social distancing does, it makes sure that you cannot spread it unintentionally.
Right.
And what I'm finding is, just coming off a shift this morning, lots of people very concerned about the virus, is that the people that I tested probably on Friday, a couple of them that were hospitalized were people who had probably got it the way Dr. Stanley said. Dr. Sandy said, it's probably just in hugging and shaking hands, but they were some of the sicker of the sick. So if there had been social distancing practiced earlier, they may or may not have been come in contact with it. And so these people are people who have had multiple diagnoses, their lungs are a little bit weak, their immune systems are a little bit weaker. Usually if the virus wasn't as strong as the COVID was, it would just be a common cold for them. But on top of that, we don't know how many interactions they've had with people who are probably asymptomatic just because they didn't feel like they had the flu or had the cold. So to Dr. Sandy's point, it's very important. I also had a patient tell me yesterday, I have Jesus on my side. And I said, I have Jesus on my side as well. However, I also have science on my side that says that you probably need to stay home and not go to your grandparents' house and things like that. So,
I mean, let me ask this question. I mean, you guys, after watching, Florida is always a hot topic, whether it's politics or whatever. But after seeing all of those kids on the beach, what did you guys think? I mean, social distancing is supposed to be in play. I mean, when I saw it, I said, I can't believe this, man. I mean, kids are dancing on the beach, hugging, kissing. I mean, as docs, what do you guys think? I mean, anybody, what do you guys think?
Other than crazy?
Yeah, they're petri dishes is what they are.
And that's my former state. I'm just like,
yeah.
Are you serious?
Yeah, they feel healthy. They think that because they're young, they are going to have a mild disease, but they're going to track this stuff home to other people and infect other people. They are essentially carriers, is what they're doing for the enjoyment, for those few 5 minutes that they want. So it's somewhat of a selfish act, really. But yes, and then going, it's a hard time. It's a hard time.
I'm not sure that all these folk have the same knowledge that others do. Mm-hmm. I'm not sure the information has got completely out to everyone, Wow. And then early on in this thing, politically, there were certain parts of our population who thought it was just another political play that was going on, and that this was just another regular flu. And so therefore,
you're not talking a particular news news station with 3 letters in it, right?
I'm just
begins with F.
I wasn't trying to point anybody out.
Just asking.
People know what I mean. You know what I mean? Early on. Now, I don't think they're saying that anymore. But the news has to go out. I mean, we have to make sure that everybody has the information. And to add to what I had said before, I saw information out of China just during this weekend saying that 4 out of 5 of the people infected in China were infected when they did the tracing, were infected by folk who did not know they had the virus. Mm-hmm. That's 80%.
Yes.
So people, just like I said, people who feel fine, and so therefore feel they can do whatever they need to do, not knowing that they are carrying the virus, infected someone who got sick 80% of the time.
One of the things is that it's very similar to what we experience every single year and every year since the Spanish flu pandemic in 1918. And the fact that there's many individuals, all of us here may have had a flu at some point in time and been completely asymptomatic. And so what Ian is saying is the fact that we absolutely can transmit this. And we don't think in terms of the amount of times that we touch our face, that we hand our credit card off to the teller or to the checkout clerk, that we hand our phone for someone to go ahead and take our picture, and this transmission that's there. I remember kind of watching this sitcom one time, this Bernie Mac show, and he was showing how he highlighted all the toys and how it passed around from hand to hand from the kids playing and how it just transmitted there. And he was kind of like going, if we could see for a moment what happens when we transmit from door handles to all these different things on a consistent basis, we would go crazy. And so the problem is overall is that our youth have a sense of invincibility. right? And it's not until you get a little bit older, you start to kind of get some wear and tear on the mileage, that you start realizing I need to take care of myself more intentional, and that my actions may play a role in others. And I think that's where there's a loss in certain segments of the population in thinking that maybe my actions don't have a domino effect on others. And for us individually, ourselves as well, we have this heightened sense now that there's all of this news that's readily available on social media and through the news agencies as well. But our intention needs to be washing our hands the same way if we have been slicing jalapenos to put on nachos and need to take our contacts out. We're going to
I like that. I'm going to use that
making
one.
sure the hands are nice and clean. Yeah.
Wow.
That's a good one. I want to jump in right quick and go back to the myths. In some of our communities, you're hearing different things. I know Pastor Morris talked about, different things that you're hearing about how to get rid of it. One of the things I've heard is how the virus may live in your nasal cavity, or it looks for cool places. And you can go ahead and this sounds crazy to me, and I even feel crazy even saying it, but you can go ahead and take a blow dryer and blow dry up your nose to try to cool or heat. I don't know what it was. I didn't do it, and I couldn't do it. But you're hearing a lot of these things that are just, I don't know, missed immediately for me. But what can a person do to vet the information that they get regarding this stuff? It starts out with, I got this from a friend, or a cousin, who works in the CDC, sent this type of information. And immediately for me, I'm already on edge when I see this. And so, but a lot of our people aren't. And so they're getting information that just does not, I don't think, and I'm not a health professional, I'm just a person who cares about helping people. And so I would want to know, what can we say as far as vetting information?
The problem we have is that this is going on in real time, and this is a new virus, and we don't have time to do studies. You know what I mean? So a lot of the information that we're getting is I don't, it's hard to say. It seems that I'm hearing things that sounds like I'm on the internet. Oh, God told me to do this. God told me to come and tell you that. Remember, the Bible talks about false prophets. So we have people who are trying to gain influence by disseminating information that's straight foolishness. I mean, they're trying to say that this was started by somebody's military, and don't take a vaccine because the vaccine is going to spread it. Although we don't have a vaccine as yet. I mean, there are a lot of things. And I don't know. To answer the question directly, I don't know how to vet it because I don't think everything has been delineated. We don't have time, right? This is going on in front of us. And this is called the novel coronavirus because it's brand new. No one has any experience with this specific one.
So there was a particular televangelist who tried to heal some people via the television, that they are healed like that. Several crazy things are going around. People saying it. I got some people on Facebook who are asking questions, and sure enough, if you're watching and you have questions, just post it. I'll ask it. Robert Harris asked the question, what about people who live in big families? How can we keep ourselves safe? I know Robert is speaking about himself. We've been here for 1 week now. That's Robert asking that question. Come help Robert out.
What I wanted to say, at my clinic, what I've done in the past for different flus season is I go through the entire clinic and I Lysol every doorknob, every handle, any surface, all the keyboards, the telephones, everything gets done. I do it myself because I'm a little bit anal on that side, but I do it myself to make sure it's gotten done at least twice for the day. And I noticed that my staff were healthier for the season. So I would say in such a large family, that maybe they could do the same thing perhaps and make sure that they've got those doorknobs and faucet handles, the kitchen, the cups are not shared, each one has their own, and they've gone and make sure that these areas are clean, several times a day or once a day or something like that, and that each one is washing their homes with soap and water. That's one of the best ways. And then that they can also look on the CDC website for the latest information of prevention. That's all we have for now. It changes daily, but that's a place that they can look to start off with.
All right. Now, somebody else is asking if they should, they have therapy, if they should still go out to do that. What would your
kind of
advice
therapy?
be? I think it's probably physical therapy. Would you advise people to go out to do those? What?
So what I'm actually advising my patients to do, if you really need to be seen, there's still face-to-face availability in the particular medical center that I work in.
Mm-hmm.
But if this can be taken care of with telehealth, which the majority of things honestly can be taken care of with telehealth, then I would advise that you not go in unless you need to. A lot of the hospitals and institutions are reducing, unless you're in for care itself, they're not even letting you come in for people's surgeries and things like that. And I'm thinking that if it's physical therapy, I would probably, because there's a lot of touching that goes on with that, maybe postponing it for a month or so if it's really needed. Maybe asking your therapist or your provider to provide you with some instruction that you can do at home until you can connect again. That would probably be my suggestion actually at this point, especially till maybe, the end of like May 1st or that time, as far as what the government said, as far as the time we need to, our kids are out of school and the time they're asking us to really just stay in our homes.
Mm-hmm. Mm-hmm.
I
Yeah,
agree.
the person said it's physical therapy. Doc, you were saying, Sandy?
I said I agree with that. I agree with what she said.
Mm-hmm. Mm-hmm.
No,
Now,
go
Columbus?
ahead.
Oh,
Carl. I was just
Mhm.
throwing in, some people are actually, a lot of recommendations are coming out, do not go to this appointment or this appointment. And it's interesting that in this one particular case, it was dental. Someone was still about to go to their dentist, and, they had already recommended that, you don't go visit your dentist or anything like that. And so I think it's important for people to get the information, on the recommendations. Even if somebody is out there still trying to do their business or whatever, you got to keep yourself safe.
Absolutely.
I was shopping in Costco, picking up some essentials right before we got our, so to speak, shelter in place. And Costco's did a thing where they put a line down and you couldn't pass this line before you got to the cash register. And then you can't give them your card anymore. They'll just go ahead and scan it. And the lady was really apologetic about their procedures. And I encouraged her and I let her know, listen, no need to apologize, because I'm very happy that you guys are taking these measures to make sure that you stay safe and that we stay safe, because should, again, I need to come here, I'm glad that you guys are available and are open. And so the social distancing is extremely necessary and extremely important. And I'm glad we mentioned before, and I don't know if people are just now tuning in, but I think it would be okay to just reiterate how long, Dr. Sandy, if you're available, or anyone of the doctors here, if you could tell us again how long the virus stays on surfaces, in the air, and things of that nature. Again, just for anybody else who might just be coming along.
Well, they said on hard surfaces up to 72 hours. On more porous surfaces like cardboard or so, up to 24 hours. A few hours in the air. So that means, you touch something and then you inadvertently, mindlessly touch your face, and you're infected, just like that. So that's why, as Jeanette was saying, wiping everything down and washing your hands, sanitizing your hands several times a day. And going back to the earlier question regarding the big family, if you're going, the people who have to go out and come back in for maybe for food or for something, you gotta remember to sanitize your hands, change your clothes, and especially if you have vulnerable people in the house. I've heard them say even shower off. If you're going
Prior.
out to come in.
Yes.
Right.
So what
You
I'm
can do
doing when
what?
I come back from
What was
clinic,
that one? I missed that.
Take a shower if you go out to come into your family, and you have especially
Okay.
vulnerable people in the house.
Yeah.
That's how you get rid of the virus that you may have come in contact to when you were not sheltering at home.
And I even heard taking your shoes off, especially if you're working in healthcare.
Always.
Oh yeah,
Off
absolutely. Absolutely.
Wow.
Additionally, getting back to the viral strain and their lifespan, I think one practical mention is the fact, like, think about plastic bags that you bring home from your local grocers. They can live on there for up to 72 hours, right? The cardboard boxes you may receive as far as in delivery from Amazon, 24 hours. So what does that mean practically? I'm purposefully not going to put my plastic bags on my countertops. I'm not going to leave my boxes, cardboard boxes, in the house. They're now immediately going and they're being removed. And then I will spray down the countertops or wash them down with soap, etc. during that time. So that's one way. In stainless steel and these hard surfaces, 48 hours. And so that's, once again, it's not to induce fear, but once again, to just bring knowledge to the fact that we have to be very intentional in our efforts for cleaning. And remembering, once again, these phones that we live and breathe by and we put to our face, right? And these are transmitters of disease on a regular basis.
Yes.
Yeah.
Clean them.
and if they don't have any, because it's really hard to find soap these days. So if you have bleach that you're using for your laundry, you can do 1/3 cup of bleach with a gallon of water and then put that into little spray bottles if you have it, or use that as, something that you can use to clean the surfaces. I put my kids on COVID duty twice a day. They are spraying all kind of light sockets, doorknobs, all kind of stuff, because I figure since they're home from school, they need to be active besides just the school. So it's something that we do as a family at least 2-3 times a day.
Well, you call it COVID what?
I called it COVID duty.
COVID duty. All right. Now,
Don't gargle with it like the pastor brought up earlier. Don't gargle with that.
Just spray it on the surfaces. Don't gargle with it, please.
Oh wow! Now we have a few people watching, and I think someone is saying to leave your shoes or whatever outside or in God forbid, don't leave your clothes outside. But now all of you are Christian medical professionals. Now, how do you connect or intersect your faith with the whole science? What are some of the things that you will say as it relates to what you do and how it relates to faith and getting through this time?
What I have said is that we need to remember that God is in control. Okay, so you're seeing people who are panicking. You see people maybe fighting in lines for supplies and treating people very badly because of fear. So if you're a Christian and you understand that God is in control and that He is watching over us, those of us who are Christian, then that gives us a sense of calm, and then we won't be doing some of these crazy things. And so the family members that I have and others, we encourage each other with those kinds of words. I don't know if you can use that to encourage those who are not Christians, because they're kind of on their own. But that's what we say to those who are around us.
I think at work, since we are Christians, our demeanor is different. And I think we come with a calm demeanor where we can tell the patients to relax. You've got this, take each day one day at a time. Some of them, I'll ask them to go to their spiritual corner because we can't necessarily be as vocal with that. But to get themselves in hand, to have a relaxing time, to turn off the media, because if you're watching this 24/7, you will go absolutely crazy. You will be so paranoid. So to really take a step back and breathe, check on people. The government recommended that you check 5 persons a day. So take that time to talk to others and be relaxed.
Doc Columbus, I know you are strong on diet and stuff like that, foods that we eat. During this time, is there any advice as it relates to things that would be better for the body?
Yeah, no, absolutely. And I think probably all of us on this call understand the importance and the role of nutrition in chronic disease and arming our body from a standpoint of resiliency. But just to briefly highlight the former question that was kind of brought up in terms of the intersection between faith and action is, the scriptures tell us the fact that we need to take action, right? In terms of with our faith and so forth, faith without, we have to be able to move. And even in the Bible, in the time of the Israelites, they separated out the lepers and they did social distancing. They went ahead and they prescribed as far as strict hand washing, cleaning rituals to kind of make sure that we did what? We diminished the spread of disease. And so they are not mutually exclusive. It's not an issue of you either have faith or you take action. It's an issue of both, because we know that our actions alone don't protect us. And that's where we rely upon our faith in God, that he will still provide us the overriding protection, right? And so I think that that's key for folks to remember, is the fact that, yes, you want to be intentional in your efforts, but you don't want to succumb to fear. That fear without realizing that we have resource and the power up above, as well as in resources in what he's provided man with knowledge of physicians and scientists to develop methods to help offset this onslaught of disease. In terms of nutrition, it goes hand in hand. Everything is all tied in. We know that individuals who have chronic disease of high blood pressure, heart failure, heart disease, cancers, that they are the ones who are at risk, who have respiratory issues, are the ones at greatest risk for succumbing to COVID. We also know that by attacking lifestyle through nutrition and activity and so forth, that can help diminish chronic disease. But what can you do in the acute phase? We do know that certain foods and citrus and mushrooms and cruciferous vegetables can be very additive to helping your immune system. And those are extremely powerful. We know that it's not just solely taking vitamin C, but it's actually that you have about 1,000-fold increased magnitude of effects from eating the orange over taking an oral vitamin C. Not saying vitamin C oral tablets are bad, but telling you that eating the real food, the whole food, filled in with micronutrients and phytonutrients from the berries and the citrus fruits, the grapefruit, that there's power as far as inside of that for helping to aid. Will it help prevent you from having a communicable disease that's transmitted through touch, through airways? No, not necessarily, but it can help arm your body to help it fight as best as possible.
That's powerful. Could you reiterate that point regarding the supplements? Because there's some individuals who are, kind of mega dosing on supplements. What would you say? Reiterate that point. I know you said there's nothing wrong with doing that, but how would you address individuals who are just going out and, i.e., example, me, getting a whole lot of I got a stack of stuff.
You're telling on yourself. You're telling on
hey, I'm telling the truth, man. I'm coming to the altar right now. I got me vitamin C. I got me zinc tablets. I got activated charcoal. I got all of these things. Talk to us. Talk to me. Preach to me. Tell me something.
I'll start. I'll let everyone else chime in because there might be slight differences. If I'm looking solely from a medical standpoint and a scientific standpoint, what's been proven, a lot of these compounds that have been separated out of their natural origin have never really been truly proven in isolation. A few have. Some work of Linus Pauling and others with vitamin C has shown some benefits that are there. But in this time of scarcity, but here's the thing with the scarcity, going into stores, the produce is all there.
That's right.
The fresh fruits and vegetables are all there. What's sold out are all the chips and the meat and the ice cream, but all the good foods for you are still there. So there's no excuse. But in case one does have an excuse that they don't have it available to them, or they don't have the readily a fresh assortment of fruits and vegetables, then having the vitamins is certainly beneficial to you. But I think that should be your secondary avenue of ingestion, not your primary avenue of ingestion. So I still want to emphasize, see, the problem with us is we think we're so smart. We think we can pull out the active ingredient and discard of everything else. But I'm going to tell you that God is smarter than what we are. And so there's so much power in the fiber of the fruit. There's so much power as far as that's wrapped up that we haven't even been able to tease out from a scientific standpoint that can benefit your body. That's why I always go back to eating the real food if at all possible. But I am always careful not to disparage completely taking the oral vitamins and so forth, because not everyone has access in the same timely way.
I surrender all. That's all I'm going to say. if you made an appeal for baptism, I'll be coming to the I'll be coming right now.
Dr. Baptiste, you made a good point, man, and it's you talked about the history even in biblical times about isolation, quarantine, how it was a reality of life. And, and that whole balance between faith and fear and facts and science and all of that. And, one minister, they came to the minister and they told him, one minister said, hey, we got to do this. We got to do this. We got to keep things going in a certain way. And another minister had the viewpoint of, kind of coming from Jeremiah 29, just saying, seek the prosperity of the city. And to which you've been, and this is the historical. And basically, if the city prospers, you too will prosper. And I guess we're kind of like in a time where there is this balance. You have some people saying, listen, I'm going all faith, forget science. Some people are going saying, listen, Pastor McBride, he balanced it out. He said, listen, and also wash your hands. and I think we got to be real with this. And, some news agencies have been saying some crazy things. We won't name them, but we got to get to a place where we have that balance. And I thank you for that approach, man, because it's really needed right now.
And I think
it's not just, go ahead, Dr. Nisa.
No, I think asking questions, and I think just making sure that we are dispelling myths and misinformation that comes as 24 hours a day, and having conversations like this so we can dispel myths and speak to truths. I think it's important. We talked about our younger generation. I think that there's just, until people feel it, they really don't grasp it or understand it. But I think if I can tell you that today I had a lot of people who were under 30 I was talking to, and they're just really trying to understand because of the fluidity of the disease. And so I just think that we have to just be open and honest as professionals and spread the word and make sure that we're giving good information and that people can ask your health professionals, send a message in, find out. And I'm not telling you to call us and email us every day or anything like that, but I'm just saying to ask the questions, make sure, ask what's a viable resource, who should I go to, what's going on. And even the viable resources that we've talked about before, it's new and it's novel, so we don't really know. Things are changing hourly and daily, but I just think that we just have to dispel myths and make sure we're compelling with our truths and just be honest. because as health professionals, I'm very honest with people. I may not know that. This is the information that I have this far, and this is what I know we can do for it to be helpful towards you and your family. And I also think that we have to put a cry out for those people who have increased anxiety, because there's a baseline anxiety that some people and depression that people have at this time as well. I'm seeing that a lot in my clinic as well. So helping to support them, because our mental health services are just not where they need to be anyway. So maybe, calling the people like Dr. Jeanette talked about and making sure that we're supporting each other in this difficult time and in a time of uncertainty. So I just think that we have to just be on it and using the resources that we have and using, the church as a platform, and our Christianity and our belief in God as a platform to provide us with stability, as well as those around us and those that we serve.
Before Pastor McBride come in, there are some comments online. I'm going to share a few of them. Colleen Swaby Laws says that the World Health Organization recommends that we should have 5 different fruits and vegetables per day, and something like that. Davreen Macbeth said that what did she say? She said something about the CDC.gov provides valuable information and daily updates regarding COVID-19. And we have another comment here from Lyndon Edwards, who said that Loma Linda School of Dentistry will not be doing non-emergency procedures. So somebody who was asking about their dental procedure, they can get information on that.
And that's by the ADA. The ADA's pretty much made that wide, the blanket statement.
Yeah, I think most dentist offices are just closed. They're just not seeing patients because they're very vulnerable in the work that they do. So, they know they should shut down. I don't know. Someone was talking about. I think it was you, Dr. Count, that was saying that one of your patients was talking about going to the dentist. I don't know which dentist that is. It's staying open today just to see regular patients. Because listen, Senator Rand Paul tested positive. I don't know if you guys saw that in the news. Yeah. And the German Prime Minister is now in a quarantine for 14 days because the doctor that gave her an injection on Friday, he tested positive.
Wow.
So, this goes again to what we were saying before, that there are people who are carrying and spreading who have no symptoms whatsoever.
Yeah, listen, I'm thankful to you guys for coming on, taking the time out to just have this conversation. Like Dr. Nisa says, we need to continue conversations like these so that individuals will be informed, and even if that's not their purpose, but at least it will help to lift their spirits. Now, here's what I want to go to. I want to acknowledge and appreciate all of you who work in the medical field. You are on the front lines. You are, it's like at war, and you're those soldiers, those foot soldiers going out to meet these challenges. And I personally and my entire team at church, the entire church, wants to acknowledge and recognize your services. But I want for you to share what are some of the things you face, and how can we reach out? What are some of the things that we can do for healthcare workers at a time like this? I know prayer is good, but just say, what are some of the ways that we can reach out? Maybe not to you, but to others.
I'll chime in. I think many of us got into this area because we have a passion and mission that's there, and there's many in the industry who are very, very afraid and scared right now, like everyone else in the population. and yet they're still there, and they're mainly afraid about bringing things home to their family. I think just the word of encouragement, like you just gave, either in the form of a text, for me at least, and for many, I think that word of appreciation. We're not oftentimes, believe it or not, appreciated on a basis with our staff and everything else that sort. So just that acknowledgement, I think it goes a long way in terms of just letting us know that we're in your thoughts and prayers, and if there's anything that we need. That's my perspective.
I know one of the things I appreciated, and Nisi just did it, and I appreciate this when I go to the doctor, and I think it needs to be said out there for our members and people who struggle with what kind of help they're going to accept and take, whether it be scientific or whether it be help from the word. Is I appreciate your honesty regarding information. I know this, or I don't know this, or let me look into that more. That matters, because I feel like a lot of our members place a God persona on some of our doctors and expect that you should have all the answers. And it's one of the things that they use to decide whether or not they're going to accept information that comes from a medical professional. And it's imperative that they understand that you guys are human, that you guys get information as well, and that as novel, and I love that Dr. Sandy has kept pointing this out, this virus is novel, it is brand new, we are still getting information as we speak. It's important to get that information out there, that folk understand this, because you have a lot of our communities, sometimes I see it a lot in the West Indian community, where they will literally ostracize medicine altogether and just decide that they're going to just, hope and expect that God will heal them. And as a minister, I'm sometimes talking to people and helping them understand, when you had individuals like Dr. Sandy, Dr. Batiste, and Dr. Nisi and Jeanette go to school, and they were taking a test, and they wanted to make sure that they passed this test. And these Adventist doctors, who did they pray to? And that gave them the answers, and it helped them work through this, and then caused them to pass. Now they're successful and they're going through these things. And so it's imperative that our people understand that there is a handshake, and a wonderful handshake, between medicine and the Bible, and that they both accompany each other and they both complement each other. And I love the fact that you all are recognizing that. Dr. Batiste, you spend a lot of time in your efforts and in your seminars pointing people to these kinds of information. And I think that the message needs to continue to go out there, because one of the sad things I'm hearing, and I know it's novel, is as soon as a vaccine comes out for this thing, don't take it. You're hearing that in some of the communities. We're not going to take that vaccine as it comes out because it's going to be crazy. It's going to be this. You're not going to know what it is. And for me, and I guess this is big for me, because, and I'll just point out something, get a little vulnerable for a second. My mom passed away in 2015 from breast cancer. And one of the things that was amazing to me was how my parents at that time had decided that they were not going to do modern medicine to help out with this situation. And it blew my mind. I was upset and couldn't understand why you couldn't think that both of them would work. So it's really important that the message gets out there, that our members can see that modern medicine and biblical medicine can handshake. They can work together. They do.
Well said.
I thank you for sharing that, Pastor Ed. As one of those individuals who is on the front line, but also encouraging ministers on the front line, I'll share just a little story. And when people are letting you know from all over the world, they're praying for you, they're asking how you're doing in your area, and even in the midst of all of this, to make you laugh. The humor is so healing. It almost gives you that boost to go through the next hour. Someone even sent me a video. My cousin in another country sent me a video last night, just to remind me that we'll get through this. And it was a little humor, even based on the situation that we're going through. not making light of the situation, but just letting us know that, hey, we're going to get through it. Take some time to laugh. One of our chaplains, we were just in a group text the other day, and we were just laughing, just talking about different things. The person said, "You guys just made my day." Like, that really helped me to get through this day. So I think let's not forget, we can help each other just with a little humor, little levity, that can help us through these tough times.
Well, somebody just sent me it's a WhatsApp, and I guess some of you may have seen it. It's a post from a Tennessee pastor. That's what it says. "I trust God and I wear my seatbelt. I trust God and I wear a motorcycle helmet. I trust God and there are enough life jackets in my boat for everyone on board. I trust God and I use oven mitts with really hot dishes. I trust God and I lock my house at nights. I trust God and I have a smoke detector. I trust God and I have my prescribed medicines. I trust God and I will follow the best guidelines to share the tasks of flattening the curve. Acting with caution and wisdom does not indicate a lack of trust in God." I just got that while Pastor McBride was speaking on the same thing. And we all trust God. We all trust God, but we want to do the best we can to limit or even eradicate the spread of COVID-19. Thank you guys for the conversation. Thank you for taking the time. And Dr. Batiste, I got some fruits. I'm gonna I got some vegetables.
I have some cuties in the fridge.
I'm gonna go back to Eden. And
There you go.
but thank you guys. I really do. I really appreciate you guys taking the time, and I hope we can do some more of these and share even as the days go by. Any final words from anybody, and then we go.
Yes, to what Dr. Batiste was saying, and also to answer your question about what would help us as providers is the people having a strong immune system for us to work with. You know, when your immune system is already strong, the likelihood that you'll end up on ventilators that we don't have enough of would be slimmer. So we do want to make sure we're eating our fruits and vegetables of the rainbow, all the colors we need to eat every day. But I noticed once the government put this stay at home and be safe in place, the neighborhood got quiet. Nobody was outside. Nobody's walking, and you need to get out in the sun. Absolutely. Part of your system is from the sun. So it would be great for everybody to get out in the sun at least 15 minutes twice for the day. I mean, those with medications and different health problems, of course, to what your doctor has recommended. But we need to be outside. We need to drink our water, our 8 glasses of water, unless the doctor says something different. You go according to what your doctor has told you. But we're not drinking enough water. We see a lot of dehydration, and these people are getting very sick, and we just don't have the resources for everybody. So what would help us is everybody working on their immune system and staying healthy, following our 7, 8 laws of health, your spiritual care, right? Your sleep, making sure your sleep, your stress management, all of those things.
Awesome.
I would mention, in this time of social distancing, let us be mindful of honoring and being committed to these CDC guidelines. We don't want to, as Lyndon Edwards just posted in, we covered this earlier, we want to make sure we're not overwhelming the healthcare system by poor practices in terms of our hygiene. And even while we have the social disconnection, let us also be mindful that we can still have spiritual connection. And I think a host of our churches, worship centers in this country, they're finding novel new ways of connecting. And I think we can always have spiritual proximity while we still practice social distancing. And that would be even a beautiful balance even right now.
I'd like to add to what Jeanette was saying regarding hydration. I think there are many people walking around chronically dehydrated. It causes a lot of problems. And if you were to get one of these illnesses, especially this, and your hydration status is low, it's almost the same as having a comorbidity. You're starting off behind, you know, and you're going to get sicker than someone who was paying more attention to these kinds of things. So drink enough water, please.
All right.
Please.
All right. I'm going to get 2 bottles right now. Thank you so
Yes.
Thank
And you
so
don't
much.
have to stand in line to tap water, they say, you know. It's okay. Don't, you know.
It's good. It's good. H2O.
Yes.
H2O.
All right, guys. Thank you so much. I really appreciate it. And let's stay connected. There are several individuals on the Facebook, on the church's Facebook and other places that are appreciating what you're doing today. Someone says, I think it was Lyndon who says, thanks for spreading knowledge. So thank you all for taking the time. And we
Thank you.
really, really, really appreciate you all
You got it.
for this. God bless.
Welcome.
Take
Thank you.
care.
Welcome.
Everybody be safe out there. Blessings.
Yeah.
Okay. Bye-bye.
All right.
Bye-bye.
Bye.
All right, everyone. Bye-bye. Thank you so much.
You're welcome. Bye-bye.
Take care.